Hello, everyone, and welcome to Occupied Thoughts, a podcast brought to you by the Foundation for Middle East Peace, FMEP. I am Hilary Rantisi, a 2025 Fellow at FMEP. Today is July 10th, 2025, and I am privileged to be in conversation today with Dr. Yasser Abu Jamei about Palestinian mental health in Gaza. Dr. Yasser Abu Jamei is a Palestinian psychiatrist who heads the Gaza Community Mental Health Program. I will be referring to it in the program sometimes as GCMHP. He is also the leading independent Palestinian non-governmental organization providing mental health services to the inhabitants of the Gaza Strip and training for mental health professionals. He became Director General of GCMHP in January of 2014, following the death of its founder, Dr. Eyad El Sarraj. A fuller bio of Dr. Yasser Abu Jamei will be posted with this podcast in addition to more information. So welcome, Dr. Yasser. It's a true honor to have you join us. And as I think about having you with us today, when we think of mental health, it's something that we all think about here. And I think we all struggle with how we think about what's happening on a daily basis with the atrocities continuing to take place in Gaza. It's hard to imagine everything that's continuing to go on, the genocide, the killings, aerial bombardments, the starvation, the displacement, the torture. And where does one even start talking about mental health? You are a mental health professional. You head a foundation, an organization that deals with mental health. And I think many people would be surprised to know that you are still functioning in Gaza. So I was wondering if you can share with us, how is that possible? How is GCHMP still functioning? So incredible. Share with us about all the staff, the amazing professionals who continue to provide loving mental health care in the midst of this horror. If you could please share with us what you're seeing now.
Thank you, Hilary. First of all, thank you very much for hosting me, for inviting me for this podcast. And I am really honored to be with Foundation for Middle East Understanding, and I look forward to a productive and insightful discussion. Yes, it's a big question, really. It's a big question. How do we function, or even why do we work at this moment? When we speak about Gaza Strip, everyone knows now that at the moment, everyone who is in Gaza Strip is impacted by the ongoing genocide. And when we say impacted, it's a story that is full of not only horror and terrification, but also has very unbelievable characteristics. I mean, it's not only the suffering that is due to the ongoing, recurrent, continuous bombardment of being killed that is going now for 21 months, but in a very strange manner, it's coupled with multiple displacements of people that are supposed now to stay in about maybe 20-25% of the already small geographical area of Gaza Strip. Not only that, but also that people are struggling with finding food. And finding food is a problem because this is something that isn't used. Israel is not allowing food to enter Gaza now for, I think, the third month or the fourth month. And people are reports, international community organizations, they speak about famine in Gaza now for months. Problems with even milk for children, milk powder, and more difficult things. When the war started, we had a question in GCMHP that whether we need to start working or to wait, because ideally, in ideal world, if you could say, a catastrophe or a disaster will happen for a certain period of time, and then when it stops, aid comes in, and with aid comes a lot of support, including health support, including mental health support. And in other places, people are, this usually takes maybe minutes, like in case of maybe volcanoes or like storms or tornadoes, like in the States, and then life goes back to normal, if you could say, and a lot of aid comes in. But that's not the case in Gaza. 2 or 3 weeks after the beginning of the current war, we thought that we cannot really continue to wait until a ceasefire is reached, because it was apparent that this is going to be for a longer period of time. It was apparent that devastating impact on the population. And it was clear that we should really start working as soon as possible. And that's why we tried to rearrange our work and to continue our activities. We had different interruptions. The causes are different, but on top of them, that 2 of our 3 community centers or clinics were completely destroyed, and 1 was partially destroyed. I mean, the one in Gaza City, which is a lovely, nice 7-story building that took us about 3 or 4 years to complete the construction, was not accessible since October 2023. In the first few months, we heard that it sustained heavy, let me say, impact, from bombardment. But now at the moment, there is nothing that is there. It's just not there anymore. Our community center in Khan Yunis, we continued to work there until December 2023, but then we couldn't really continue to work from there, as the Israelis started to operate in Khan Yunis in December 2023. The one in Deir al-Balah also had partial damage. But also with each time a place was impacted, we were trying our best to operate from a different location. One excellent example is what happened in the south. So, although we couldn't really continue to work in December, after December in 2023 in Khan Yunis, we managed to organize ourselves in Rafah and start helping the population that was already displaced in Rafah. And this is interesting because most of the people in Khan Yunis area started to get displaced in December and January and February towards Rafah. And we were displaced with them. I personally, I was displaced with them. And in February, we managed to start a second community center in Rafah city. And we worked from there until something like mid-May, when Rafah became under attack. It's the land operations. And then we had to find something else, So we returned to operate from Khan Yunis, but from a different location, from a different place. And that's how things were. this is the physical aspect of it. But on the other hand, my colleagues, the staff, the healthcare workers at large, and the mental health care workers are themselves, we are ourselves impacted, because we hear the bombardment, we are afraid, we see the fear in the eyes of our families, of our kids. We have nothing that we can help them with. Most of us were displaced multiple times. Most of us are now living in tents. Very few, they have their houses still intact one way or the other, very few. But our mission is all the time to support the Palestinian people, try to alleviate the suffering, the psychological suffering that is caused by the violations of human rights, and in this case, by the genocide that's going on. So that mission that we have couldn't really stop when a genocide is going. That's why we kept struggling to help our people. And that's why our interventions now mainly focus on some of them are preventive, but some of them are just trying to, if you could say, buy time, because people are really struggling with the daily life. You cannot leave them with the despair. You cannot leave them with the horrifying events. You need just to give them some recommendations, some advices, some support. You can tell them what they can do in order to help their kids, in order to help themselves. And we all the time speak about how children behavior, for example, changes in times of adversities or in days of atrocities. So a lot of children, they become, if we could say, disobedient, they become more, let me say, aggressive, if you could say, more violent, And this is a very simple sign that, we live in a very harsh conditions. We are not happy of what happens around us. We reject the whole situation. We refuse to be part of it. And that's why we reject everything and we show it one way or the other. Children are different from others. They have their own ways of expressing themselves. So if you don't really tell parents what's going on within the children's psyche, they will think that our children are not good children anymore, and then they might react in a very also violent way. And then we are going to have a cycle of negative responses or negative coping mechanisms, whether from the parents or from the children, that ends up with making lives for both more difficult and ends up with making children more and more prone and vulnerable. So when you come to the tent, you send your psychological first aid team, which is usually composed of a man and a woman. They go in pairs and they visit the families and they tell them, how are you guys? What are you doing? What have you done today? What are your plans for the meals? How are you spending your time? How are your children? Just very simple questions. And then they open the door for just to hear from the people what are their complaints. And then they give some certain advices. And we try all the time to take with our PFA, psychological first aid teams, a small gift, if you could say, we call it psychological first aid kit, but it's basically some stationery like crayons, papers for drawing, or toys if available, And since the war began, we added to that some hygiene tools, very simple things that are needed by girls and women, because unfortunately these are not available now. And dignity is a very important issue that we need psychologically also to understand and take good care of. So those colleagues, the psychological first aid workers, will go and visit all the places. Interestingly, almost all of them, they wake up in the morning, they leave their tents, they say goodbye to their children, to their husbands or wives, and then they come to our community center. And when there were days that even fuel was not present, they would just work in their neighborhood, which means in their camp, which means that around the school, the shelter that they are staying in. Then they provide the psychological first aid. They take some notes of the people who need more attention. They provide this data to our teams in the community centers. And our teams in the community centers can either visit or request the visit of the people who are more impacted in order to provide more counseling or to provide therapy if needed. So these both are the very simple but main interventions that we continue to provide. Medication is very important, especially for those who were already on psychotropic medications. Continuing to provide the medication was very huge need. And we spent a lot of huge efforts in terms of lobbying and advocacy, If you don't speak about mental health, no one is going to think about mental health. Even in times of war, if you don't really bring the attention to mental health, everyone will think about only the physical aspects of things, And that's why since the first, few weeks, we continued to highlight in terms of talking at the mental health and psychosocial technical group, in technical working groups in Gaza, within the healthy cluster, for example, the child protection cluster, the international clusters, the donor community, the international, supporters of the importance of the continuity of availability of psychotropic medications or medications that are needed for patients with mental illnesses, because a patient that has a mental illness is not only a burden on himself or herself, but also on the family. And that's why the availability of medication could really help a lot the families. Of course, now we are really proud that throughout the years, I mean the decades, GCMHP became a knowledge-based center, that we have accumulated the huge experience. And whenever there is a need, we have all the time plans to pass that knowledge to other stakeholders, to other community workers, or to other mental health professionals. And that's why we used to have about 1,000 trainees who received training within GCMHP until the beginning of this war. Although the circumstances are very difficult now, but we delivered, I think, training to about 200 people in 2024. And
Amazing.
now we continue every now and then to provide training. And guess what? I mean, the main aspects of the training topics, one is psychological first aid, because there are more organizations interested in the field. So they need really to know how to provide this simple but important intervention, but also to sometimes train humanitarian aid workers on how to respond to the people, how to be, let me say, sensitive to the issues, how to talk to the people, sometimes even how to break bad news, And finally, one thing yes.
Sorry. Are you talking about humanitarian aid workers that may be coming from outside? I'm not talking about the Gaza humanitarian disaster which we're experiencing now. I'm talking about maybe some of the other international organizations.
I mean, it's mainly people who are from inside Gaza, because even those international organizations who come to Gaza, I mean, they bring some sort of their management, okay? But the tools, really, the people who are on the ground are mostly Palestinians who are already in Gaza, who just got the chance to provide some work or to act. In very limited situations, we have experts that come with those organizations, and in some certain cases, for example, like medical missions, those are based on experts who come from the international community in order to provide, for example, delicate operations in the health sector, for example, or something like that. There were also some people who came on medical missions who are like psychiatrists or mental health therapists. There are some organizations that provided that. For example, PAMA, the Palestinian American Medical Association, provided some missions. I think MAP UK, for example, provided some missions. Mission of Hope provided some missions, and there are different actors. PCRF also here, Palestine, they every now and then they bring their expertise from abroad. But when it comes to the daily business, daily work, for example, relief work, it's something that is done by local staff, hired by international organizations, but by local staff.
Yeah, the context is very important, and you always talk about that, and bringing experts from outside does not necessarily address the needs of the people, and so having the expertise of your professionals on the ground, not only supporting and informing people coming from outside to provide any sort of aid, but the expertise that you've accumulated also over the years. You've talked about training, thousands of people. And even during this period, it's miraculous and really commendable that you've been able to train even more people during this period. Yes, it's just amazing to hear about this. I'm wondering if you can, you talked about coping mechanisms. You talked about children reacting in such a way that maybe parents would not have the right way to interpret what's happening with them. But I'm wondering if you could talk about both positive and negative coping mechanisms of how people are surviving this period.
Well, in the first place, I need to stress that the use of word coping is now not the best, I think, not the more accurate one. I mean, we are in a situation that we have no choices in our hands.
Yeah.
You are put in a corner that's called Gaza Strip in 10 or or 15% of that corner. For example, in the southern areas, Rafah is empty, East Khan Yunis is empty. Now everyone is in like Mawasi Khan Yunis. And you are pushed to that small geographical area, and you are even being bumped in that geographical area. So what can we, can we use the word to cope, to adapt to that? Of course, it's beyond the chance to cope or to adapt. You are there until further notice. And a lot of people, they say we are there just until we die or until the war stops. There is no third alternative. So, but we see that when we talk about, for example, the psychological impact, while a lot of people talk about, symptoms of trauma, symptoms of stress, we also speak about, for example, again, about violence, about these signs of rejections. We can call them negative coping mechanisms or styles, or we can call them symptoms of trauma, because sometimes they fit here and there. But of course, we also speak about some other things that is now really widely seen in Gaza Strip is, the how people are dealing with the dire need for food, the dire need with water. This is a community that never attacked a merchant, never attacked a businessman or something like that. But now we have seen the looting that happens to the trucks that come every now and then. When there is a truck, that was seen in certain periods of time. And sometimes the looting that happens to some warehouses when they are there done. Now, this is something that is new to the Palestinian people, this act of, like, if you could say, criminality of this thing. And the question is whether this is understandable when you don't have food for your kids for already more than a year and a half. Is it a sign of desperation? Is it a sign that you don't believe any more in the distribution mechanisms, for example? Is it a sign that, but again, if a father of 3 or 4 kids, who's sitting in a place that doesn't have any food for the last 2 or 3 months, what he could do. And when they hear that there is a truck that is coming with flour, I think that's quite understandable that they might go. But at the same time, this is not a healthy response. Then we start to talk about negative coping mechanism. When we talk about the increase in domestic violence, increase in gender-based violence, increase in violence against women, increase in violence against children, of course, the whole area is really violent. You live in a place that is nothing but a rubble. Everywhere around you, you find the rubble of a destroyed house, or an infrastructure that is destroyed, or maybe a destroyed school, or a health facility, or something like that. How can you maintain a good psychological health? Of course, it's impossible. How can you keep the morals high? It's very difficult also and very challenging. How can we continue to talk about morality and justice when the international community is watching this genocide going for 21 months now? What can you tell those people? How can we blame them for trying to, by their own hand, try to grab a bag of flour for someone who haven't seen flour for the last 2 or 3 months? What can we do in order to do that? At the same time, we continue to see great examples of positive coping, if you could say. When the ideas of sharing, when the practices of sharing between Palestinian families continue to be there. When we have more than 17,000 children who lost both of their parents, and now they are, and in some other statistics, 19,000, and they are all now sitting with host families, who are, of course, from the families, like they're from their like paternal side or maternal side. Or, by the way, in some situations, in some cases, someone who have met a child just in the street, and she or he just saw that child alone. Where do you come from? What is your name? Where are your family? And the child doesn't give any answer. And then that family will take the child and add him or her to their own children until further notice. And that further notice in most of the situations is still open until now, because there is no news about who are the parents of that child, you know. There are tens of children who are less than 1 year old who were the only survivors and the only ones to be pulled from beneath the rubble, you know. We have many of those stories. So there is a lot of host families that, despite not having enough food to feed your children, they accepted additional children, you know. When you look at, you know, the people still try to open spaces to each other, you know. I mean, places are more and more crowded, getting more and more crowded. But when tens of thousands of people are asked to what we call evacuation orders for tens of thousands of people to leave their neighborhoods, they just go and try to push themselves into the neighborhoods that are already filled with people and exhausted, and still they allow them in. You know, one way or the other, they allow them in. And, you know, we have this practice. It's one of our traditions, you know. This is something that's rooted in our culture, in our Middle Eastern culture. You know, when families visit families, when there is not enough space, then they try to arrange themselves. For example, women stay together, men stay together, okay? And children stay together. That offers, of course, it's the same space, but we can even accept more people to come in. And then men and women, I mean, the inside space could be only for women and children, and men go just outside and sleep on the streets, you know, or just outside. You know? I mean, this is something that continues to happen and continues to show how things are happening. So, I mean, and then the concept of faith, the concept that we are on the right side of history, that justice is in our side, that freedom is our aim, is our hope. I mean, this is a nation that is struggling under occupation. Okay, I mean, so our, like, you know, history taught us that occupation can never continue forever. Apartheid can never continue to be forever. But of course, this is now the current genocide. Tens of thousands of people are killed, hundreds of thousands of people are being injured, and the population is really suffering a lot.
Yeah, it's hard to fully comprehend. You know, we see these images, we watch reels coming through our phones, but the reality of it is something else. And I think, you know, the images that you're drawing for us are unbelievable. I mean, I think it's hard to fully fathom, and I feel like we will there will be so much more that we will be learning about these individual and collective stories. I mean, you also, I mean, this Gaza, we're not just talking about the last 2 years, we're talking about also transgenerational trauma and people living through this over and over and over again. And so I'm wondering if you can tell us maybe a little bit about what people are saying. What are their thoughts about a possible ceasefire? I know last January with the ceasefire, there were definitely expectations and imaginations of what things would be like. And the reality was different, maybe in some cases. We are now at the moment when a ceasefire might be announced anytime now, but we all know that ceasefires are not necessarily on the terms of the people, and somehow the people in Gaza are continuing to survive one situation after another. I'm just wondering if you have anything to share about what people are saying in their anticipation, in their hopes for the future.
almost every day now about 100 people are being killed,
Yeah.
and hundreds are being injured.
Yeah.
And most of those are killed in what's called humanitarian area, like safe area, I mean, the attacks on Mawasi area, what's considered, people are to be displaced there, and then the attacks happen there. We don't know what terms are going to be, but we hope that the ceasefire will happen as soon as possible. I hope that happens even before this meeting is over,
Yeah.
And within this genocide, we had two moments where we had some sort of ceasefire. There was a small truce for 8 days in November 2023, and
Yeah.
then there was almost 2 months ceasefire between January 18th and March 17th, 2025. And we hope that the third one is going to be a permanent one, although, we're not sure how this is going to happen. But again, I am a mental health professional, and I like all the time to focus on things really look on the ground. At the moment, even if a ceasefire happens now, there is a different struggle that people will start to have. Okay, some say 80%, some say 80%, 85% of the buildings are destroyed, which means that maybe 1,900,000 people will have no place to return to. We speak about a terribly impacted infrastructure with almost no water supplies that are really functioning. And this applies also to power supply. Power supply before the war began was on average 8 hours per day. Okay, so just to have a space to stay in will be a challenge. And then the rubble that is spread everywhere. And that rubble has a material polluted with the material, because we know those bombs that are falling are not made of natural substances.
Yeah.
These are terrible carcinogenic substances that will pollute the ground, will pollute the water. Even the water that goes to the Israeli people will be polluted, by the way. It's one same small geographical area, and it's very interesting how things are going to end up with. But anyway, and then there's a big question about the ability to harvest your own land. Can you harvest? Can you find crops? Would that food be eatable? Is it going to be good? Yeah. So those supplies that are going to be coming through the international community, how many trucks per day are they going to be enough? And after how many weeks we are going to have enough flour, for example, for people? And then cooking gas, what's going to happen with cooking gas? There is some very small details in our life that sometimes we don't feel them because they are for granted, They don't exist at all today in Gaza, and they will not exist in the near future. In 2014, when the war stopped, it took 1 full year for the first house to be rebuilt. 1 full year. Okay, so people are not going to return. To live a normal life or to lead a normal life. And then education, a very important component. Our children are without education for 2 years now. They missed the academic year 2023, 2024, and now the academic year 24, 25. 2 years are gone of their academic achievement. What does that mean in terms of the capacity of children to receive education, to just get themselves learn, how to follow the regulations and the rules of the classes, school classes, understand the teaching, follow up with homeworks, all of these things. This is all interrupted. How this is going to be resumed? This is another big question. Again, water, I mean, this is going to be a big challenge. I mean, everything is going to be a big challenge for the life of Palestinian people. And the reports that come from the international community, that it takes 5 years at least to remove the rubble. It takes 15 years at least to rebuild what was destroyed in Gaza Strip. These are perhaps accurate, but again, all these figures can change if there is a political will.
Yeah.
I mean, removing the rubble in January, when the ceasefire was announced, the first thing that people were doing was cleaning around them. You know, they just started to clean parts of the streets just to ensure that there is a better looking place around them, you know.
Yeah, I think it's remarkable. I mean, what we witnessed and saw, the large number of people returning to non-homes, you know, returning to the north, knowing that there was no home to return to, and the joy that came with that. I think many of us just watched in wonder, amazement, and just talked so much about the dignity and the strength of people.
Well, it's a show. Sorry, Hilary, but it's a show that we have learned the lesson of 48. Okay, we are going through the second Nakba, but our people are not fleeing, you know. And when they decided to, when they were given the chance, they returned to the north, they returned to Gaza. And we speak about the population, already 2/3 of it are already refugees, you know.
Yes. Yeah.
So people really understand and value the home, value the land, and everyone was eager to return. Although, by the way, the situation in Gaza and in northern Gaza was worse than in the middle areas, but people who are like, you know, who used to live in Gaza and North Gaza decided to return, although it was more difficult for them.
Yeah, the determination is amazing. And what you were describing now was, a lot of it was in terms of material challenges of buildings, of infrastructure, of pollution, of water. But then again, you started talking about education and children getting acclimated back to what it is to be in a classroom and to going back to school and all of those things. But when we talk about the all the pain of the immense loss, it's hard to fathom what this loss means to someone. Whether, I mean, there's the compounding loss of home, of land, of employment, of health, but ultimately of life, and loss of family members, and all these different levels of loss. I feel it is a real testament that your work continues because of its importance, and that your team is there for their community. They are part of the community. They also experience the loss themselves, but are able to continue somehow. I don't know how we can express just this, our admiration for this heroic work. And I think, you know, we all want to be of support in any way we can. I don't know if there are words you can share about what do you think we collectively and individually, as organizations, as individuals, what we should be doing now.
Well, I think different organizations, different people, let me begin with a very simple thing. You know, just to try to have full understanding of what's going on, of the needs and ways to help. It's very important to have a full understanding of really what's going on.
Yeah.
And then everyone should evaluate and assess how could I help, whether as individuals or as organizations and institutions. And once you have your own plan, I can help through this way or the other, consult people from Gaza, consult people from the ground. I have this plan. Please advise. Is it right or wrong? Can we do it? Can we not do it? And then together, people who are supporting from the international community and people from inside Gaza, they need to do something together. Now, unfortunately, some of things do not go the right way. We have seen some international organizations that jump into Gaza. They already come with their own ideas. They already sometimes even take our experienced stuff, but they do not do the impactful work that we should be or they should be doing, okay? And then that's one part. The other part, which is, this is a matter that needs justice. This is a matter that needs a solution. This is a war that needs to stop. And the collective, the importance of people as a collective is in their ability to change and impact policymakers.
Yeah.
This is very important. I mean, this is I don't know how many years, 40 years, 70 years, 100 years. I mean, you can call whatever date comes to your mind. It's not 2023. It's not 1993 with the coming of the PA. It's not with the second Intifada. It's not with the first Intifada. It's not with 48. It's even earlier and earlier. I mean, so things are clear. The solution is clear. We have internationally statements about the solution to the Israeli-Palestinian conflict. Are they respected? Are human rights regulations respected when it comes to the Palestinian people? We have tens of conventions, human rights conventions. Talk about women's rights. Talk about children's rights. Are they respected? No. Why this is continuous? Each one from his or her own space, they can get more information, more knowledge, identify where they can work, and start and act. And one final thing, I think everyone who supports the Palestinian cause should now receive some kind of support, collective support. We hear of people that are under pressure, who are scrutinized at their work in academia, in universities, in their workspaces, and the efforts to silence supporters of Palestine are present everywhere.
Yeah.
We should have a reaction to that. And the reaction to that is not to give up, but also to have more support around us.
Yeah, no, thank you for that. I think we have attention to that, but sometimes we lose the focus on Gaza, and we need to continue to keep our attention to everything that's happening in Gaza so that we're also not distracted by our own conditions where we are. So in the US, there is everything that you mentioned, silencing and loss of jobs and so on. But in contrast, I think we need to continue to center Gaza in our conversations, in our efforts. And as you described the things to be done, it reminds me of something in organizing that we always talk about is use your head, heart, and hands. So use your head is to, as you say, have a full understanding, to get educated. Use your heart is to examine and evaluate how you can help. And then use your hands is to actually do the work. But doing it, I think it's important, as you point, to do it with people in Gaza, in consultation with them and not separate from them, to be informed and to use our hearts as we do the work, and our heads. So I know there are so many other things that we can talk about, but I think maybe this is a good moment to stop. I know, I hope that we can have another conversation in the future and see how we can also continue to support the work that you're doing. And before I end, I would be amiss not to mention an organization that I am on the board of, the Gaza Mental Health Foundation, that supports the work of the Gaza Community Mental Health Program in Gaza. And we will also put some more resources along with this podcast for those of you who want to learn more. Dr. Yasser, it has been an utter privilege and an honor to speak with you today. Thank you. Thank you so much. And
My pleasure. Thank you very much.
thank you. And thank you to our listeners for tuning in to this episode of Occupied Thoughts. Please make sure to check out the FMEP website, www.fmep.org, for resources related to this podcast and lots of other rich content related to Palestine and Israel. And please make sure you're subscribed to this podcast to stay up to date. You can find us on iTunes, SoundCloud, and Spotify. And you can also watch video versions of our podcast, including this one, on YouTube. And with that, I am Hilary Rantisi, signing off until the next episode of FMEP's Occupied Thoughts. Thank you, everyone.